Okay, we're going to perform a closed castration. Because I'm right-handed, I go around the other side of the table, do the incision, stabilise the testicle that will come forward the most into the midline position, which is quite hard to find in this dog. So hopefully one of those dots are. So gently in the sides, we want to do close so we don't go too deep. There's a big vessel there we need to avoid. Let's see if we can pop him out of that. There he comes. He's got some old shriveled up testicles, so first we break the attachment down here. It's like a tearing, like you're tearing open a sachet of ketchup. And then we strip down as far as we can go. So we're not pulling on the testicle, we're just holding the testicle and pushing downwards. So we'll go with that. Use the Alice tissues to stretch it out a bit. And then bring it this way instead. Okay. So we use a crush bed. We use the carmalt as crush beds because they do the line, the same line as the suture. Put those on there. Miller's ready. Here. Start position, cross, go around again, second cross, go between, grab the tail, back the other row. So that's ready there. So now we can take this clamp off, push it down. Now we'll tighten this Miller's as much as we can. So it digs in as much as we can. First Miller's on, and now apply the crush bed for the second Miller's. fairly close to that one, but not too close. Again, we get the millers ready here. And then slide it down to the crush bed. And go as tight as we can. Okay. So at this stage you want to be able to see this sort of blanching effect here and here. Now we're going to do the transfixer. We're going to drop down to 2 metric for the transfixer. Just click it in because we only need 1 pass. So you've got to be sure where the vessel is. Go and trace the vessel down the front. So we want to be going through but away from the vessel. Goes for the cord there. That's got a small vessel on the other side, which older dogs can have. And then I'm just going to tie surgeons again. So we've got millers, and then the surgeries. Fanny, la luz, el motor. We should have power in a minute, hopefully. I'm just going to take this testicle off. I want to rebreathe if they were okay for a short period of time before we get too anxious. So Release that. It's fine, let that go. Move that back in. Now the next testicle. This is just coming from some of the fat tissue in that vessel that was there. And he's just gently run over this testicle. I'll saw that bleeding out later. The edge of popping out. There we go. So same for the attachments at the back. And then we strip down again. Gracias.
Siempre hay algún problema, o la luz o el agua.
Sí. So we'll take the testicle this way. We use our various tissues to stretch it out. This crush bed. Miller's ready. Take away the clamp, drop it into the crush bed. Give it good time. Yeah. Okay, put our next crush bed in. This piece of micro. That is ready. clamp. Slide down the wires. Okay. Next comes our transfixer. So work out where the vessel is at the front there, so you can see it at the front. So just give it a good squeeze, and then we'll go around the back here, away from the vessel. Around the back here, away from the vessel. And tie it around the vessel. So here. So again you can see the blanching here. So we'll just double clamp and remove, always leave a good bit of tissue behind. Okay, so let's check it. Maybe that bit of bleeding that was on the other side from the fascia, you probably sort out now. Back in. Let's have a look. It's just stopped. Might restart when we start doing the closure, but we'll see. It appears to be a bleeding from the castration. So it's the three bits we bring together. We made 2 incisions. So when we lift up, it becomes more apparent. Start with this bit here, pick up the middle, and then we'll pick up this side. tie it off there. And we'll just follow a continuous pattern with those 3 bits. That's one side. One side. Middle. And the other side. One side, middle, the other side. Definitely rhino skin, this dog. Start leaving the middle about this stage. I'll tie off here before we go into the intradermal pattern. Take off the tail and just get ourselves into the edge of the position. Okay, I'll change to the side if so we'll just go sideways through the skin layer, making sure we don't come out the skin. And then we always go back on ourselves. Go sideways through the skin, go back to where the last one came out. Last one came out about here. So. Other side. just basically going sideways through the skin. So it's good to try and leave a little bit of a hole at the back for burial. So we'll see at the end now. So let's grab a little bite here. And hopefully we've just got this tiny hole at the end to bury it through. So I'm going to tie it off with the surgeons because I think it'll work better than Aberdeen. Keep it nice and tightish. We're going to cut that so there's no tail at all. And now we need to bury it. The secret of burial is if the needle goes through easily, the knot should follow easily. So we do a bit of probing around. Apart from the suture doesn't want to stay in. So I'm probing around here, and it glided quite well there. So that's what we're going to go for. Okay. And what I'm supposed to do is put on the thing is have some rat tooth, the knots here, and then pull on the skin towards where the knot is. There you go. So it buried nicely. Don't just pull this because obviously it'll snap quite often. You want to really be using your forceps to pop the knot through. That's good. Okay.